Well, concussions and CTE, it continues to be talked about. The media, of course, has been talking about it for quite some time. And your kids are back in school. That means they might be back on the ice. They may be back on the field playing contact sports. So to talk about sports safety, more about concussion CTE, of course, we brought one of our favorites here. Dr. Zach joins us. Welcome back to the show. Great to have you here. Let's start with concussions, first of all. What exactly is a concussion?
So a concussion, it's basically a brain injury. You hit your head hard enough to have symptoms.
Right.
So you don't necessarily, sometimes people think, oh, you need a loss of consciousness for it to be called a concussion. You don't. Any kind of head injury where you have symptoms, so headache, nausea, vomiting, you see stars, you get a bit confused. And these symptoms, by the way, there's this whole post-concussive syndrome that people have talked about, which is sometimes the symptoms can last, sometimes it's just a few minutes, but it can last days or even weeks or even months in some people where they can't concentrate, they can get depressed. And each successive concussion is harder to recover from and takes more time. So it's serious.
What should you do if you suspect you have a concussion?
See your doctor. I mean, number one is you got to get off the field.
Right.
And all teams now have, serious teams have sport physicians who are trained in this, and so they can do some sideline testing. But basically, if you're having symptoms, you really shouldn't be in the game. And athletes don't want to get out of the game.
No, it's so true.
And we don't want to tell them to get out of the game. Like, we're both sports fans, and sports are great, right? They're very healthy, and we want to encourage people to do them. But more important than that is your health and your brain health. And with all that's going on in the news that we've talked about, you got to protect yourself so that you have a good career, even if it's not a career, so you can enjoy sports for a long time.
Yeah, of course, and enjoy life in general for a long time, right?
Yeah, exactly.
Are you seeing more people coming into the ER with concussions over the last few years?
Oh, yeah. Over the past 10 years, there's been about a 60% increase in people coming in with concussion-like symptoms. A part of that is, I don't think it's necessarily people are getting more concussions, but there's definitely more awareness because of people talking about it and people talking about the potential sequelae later on.
Let's talk about CTE, because I think there's some misconceptions out there. People believe that multiple concussions and it has to be a concussion that leads to CTE. Yeah. That's not necessarily the case, right?
No. So CTE is scary. You guys talked about Aaron Hernandez earlier.
Yeah.
And it's significant brain damage. It's like a dementia, but it comes on earlier. And what we know is that it's related to or caused by repetitive head injuries. And what you're saying is absolutely right. It does not have to be a full concussion. So it can even be you bump your head and you don't have symptoms. Now, not just you bump your head, you have nothing. It's a serious blow to the head, but you don't necessarily have to have a loss of consciousness or even have a full concussion. You don't even have to have a bad headache or nausea.
So you may not have any symptoms
you may not know whatsoever. But if you do that hundreds of times over years, and obviously the most obvious culprit that we talk about is football, because we know there are a lot of head injuries in that. But like you talked about, there's other sports, including hockey is very popular here, obviously. Yeah. Soccer is very popular here. Those are two of the most popular ones.
Well, you've seen, like Youth Soccer Federation in the United States, they have banned headers in certain age groups. I think like the 13 to 15
Well,
age
up to
group.
10, no headers.
No headers whatsoever.
And then up to 14, it's very limited. Okay. And then as of 14, you're allowed to do it. And even here, the Canadian Pediatric Society, it's not the Soccer Federation, but they're really quite against headers, especially in younger kids. And part of that is the technique. And that's true not just for headers, but also for tackling in football, for body checking. So number one, as you get bigger, your technique gets better, but also you're more able to handle things.
Right.
So your skull is a bit thicker. And the other thing is, in terms of technique, as you know, they used to use helmets and heads as weapons.
Oh, yeah.
That's not the way people are taught.
They were like a projectile, right?
Exactly.
I know they're trying to fix. Let's talk about kids' sports. I mentioned, back to school. My stepson's playing football. Yeah. I have my concerns. What should we do to help protect our children in sport?
So number one is, the recommendation is really from the experts, and I've spoken to some of the main experts here in Quebec and in Canada. Really, before 14, we should be really limiting contact sports, if doing them at all.
Okay.
Now, the good news is, now football, as you know, once you start football, not flag football, but contact football, there's always contact. Hockey in Quebec doesn't start hitting until the bantam double letter.
Okay.
So basically,
that's the 13 to 15,
13 to 15,
right?
exactly. So, but if you're playing single letters, you can go through your whole hockey career as not a real NHLer, but you can go through without having hitting, and that's healthy. And in soccer as well, the important thing is to be cognizant of it. And I would really caution people to limit heading until the age of 14. As you know, people do it younger, but the problem is the younger you start doing it, the more potential damage that you do.
Of course.
And the other thing is pay attention. So if someone has had previous concussions, you have to be even more careful.
Right.
And another thing is you're more at risk of concussions if you have a history of migraine headaches or learning disabilities or attention deficit. So in those people, they should be even more careful. I think it's important to talk to your doctor about what's a safe sport, and maybe you should choose a non-contact sport, especially in young kids if they have risk factors.
And I mentioned to you as well, which I was shocked, and it was a great move. But the CFL has decided no contact during and during practice. You think of these youth football teams now. I mean, is that something you think parents should start encouraging? To start talking to coaches and football organizations, saying, hey, if the CFL is doing it, maybe we should too.
Yes, I mean I think they're setting a good example.
Yeah.
And I mean a lot of this, especially in the States, a lot of it comes from lawsuits, like what we were talking about, the U.S. Soccer Federation. There's been a lot of lawsuits, but sometimes that's what it takes. And our vested interest is to protect our kids, and we can exert the pressure. And let's face it, I mean, coaches are parents too, and coaches in general really care about the kids, and they don't want them to be injured.
Of course.
So we have to be very careful, and we have to keep in mind that athletes will minimize often their symptoms because they don't want to get off the field.
And we have to be cognizant of some of those symptoms, which you talked about a little bit earlier. This is such a big topic. You can visit btmontreal.ca, visit our blog section. You can find out more of what Dr. Zach has sent us and what he has to say on the subject. Always a pleasure having you. Thanks so much for being here. It's another hot day out there. Catherine Vernon Diamond has all your details. Thunderstorms could be in the forecast.